and proper, correct thinking on improving our physiology. So, in fact, just this week we had a lunch and learn featuring HeartMath. HeartMath is a technology that shows you how you can center yourself, your body, your being, and how you can create a coherent heart rate variability to then increase your wellness, decrease your heart rate risk, but also be able to sleep better, learn faster, decrease the cortisol, decrease the stress response, and all this is firmly grounded in science. So it's a very exciting time to be. So I'm going to show you this lovely picture of my mentor. He is, at the time, in this picture, 104.
Wow.
I know. Crazy. So he attended my graduation. His name is Fernando Lapayo, and obviously he was a huge inspiration of mine. What got me on my journey is I was interested. I mean, I started that mind-body study group, but I didn't really understand or know much more about that. I just sort of put that thought of pursuing this type of medicine on the shelf and pursued the doctorate in psychology and consciousness instead. But then life happened, and I was in a terrible car accident. I had to survive. I had a 9-hour brain surgery, and I was a mess. It took a long time to recover. The medical doctor saved my life, but it was through naturopathic doctors. It really helped put me back together and helped me feel like a whole person again. So that was my first real introduction, not just hearing about it, but be able to live it. And once you live it, you know it works. So I started out and I started attending health food events, raw food potlucks, we'd like to call them, in Phoenix. And we'd have a speaker. And this speaker at the time was 105 years young, I believe. And he just stood up and was chatting about eating, greens and healthy food. And I said, this guy is crazy. Is he for real? So yeah, I Googled him up, and he is for real. His daughter is Lee Chamberlain, the actress in All My Children. She also goes by Alberta Chamberlain. She went to school in France with Tina Turner, so you might have heard of her. So, yeah, so it's a really amazing story, and I befriended him, and I started hearing about his health secrets and so forth. And I'm going to pass around his book on this end. So this is one of his older books. If you can believe that. That was his first book when he was 107. Beyond 100, this was his latest book. So anyway, I befriended him, and it was such an inspiration. We did a few workshops together that the rooms got filled, people asked questions, and I was asked questions I didn't know the answer to, and I knew that was a bit of a calling to kind of keep getting additional training, and I just happened to land on the doorstep of Southwest College in Tempe, and I took a wrong turn. Ever take a wrong turn, but you realize it's the right turn? So it was that kind of experience for me, and the rest, as you say, is history. So that's Fernando, and it was such a treasure to have him attend my graduation. I explained he was one of my biggest inspirations. And he eats, lives, and breathes a naturopathic lifestyle. He eats healthy. His father was an herbal doctor in Brazil. And he exercised every day, walks his several miles, very, very deeply spiritually connected in his own way. So that's the mind-body connection that I'm so passionate about. And this was an image of the picture of the plane, from the plain of the Amazon River. And this was the first group I had taken, actually this is the second group, to Peru. And we were mostly medical students. We went during our break, our academic break, and spent time at this retreat center. And that book is being passed around as well. So it has some stories, some pictures. But again, it just shows you what's possible in naturopathic medicine. And this is another recent interesting device I became passionate about. It's the biomodulator, Tennant biomodulator. It's FDA approved. It's cleared for use, as a medical prescription device. But basically, you know how when you walk in the earth, we call it earthing in naturopathic medicine, and it increases the antioxidant status of our body through the transfer of electrons. Well, this device medically delivers electrons into the body in a way the cells can absorb. And we've used it in our other clinic at SCNM for relief of pain, improving the vital force, which we'll talk about shortly. And I've become very passionate about that because I've seen results. And it's like naturopathy in a bottle, like a Star Trek device. But it's using naturopathic principles to do that. And this was developed by Dr. Tennant, who was the developer of the outpatient eye surgery. He was the guy who said, you don't have to go and stay several nights in a hospital to do this. You can do it overnight or just in and out. And he got kicked out temporarily for that heresy of his to have a brilliant new idea. And naturopathy is the new, brilliant new idea that's been around as old as the earth, as old as the trees in the Amazon. And it's also the future of medicine. It's the medicine of the future, as so many people are coming to realize. So we look at the conventional system. Iatrogenic disease, that's disease caused by physicians. It's one of the leading causes of death in the U.S. This is the conventional system. All the deaths due to unnecessary surgeries, medication errors, errors in hospitals, nosocomial infections, which meaning you get them from another patient in the hospital while you're staying there. And deaths due to adverse effects of medication. So that's 250,000 deaths a year. Printed up in Journal Medical Association. It's probably even higher now since that was in 2000. But these are the concerns we have right now of a system where you're trying to fix something that's broken, looking at the body at that. Well, so the standard medical model, we look at disease as a discrete entity. We got to fix it. You know, you can identify what the disease is, eliminate it through treatment, and use evidence-based application of drugs or surgery. So what we do, we're trained to understand disease. We're trained to diagnose it. We're trained what the treatments are conventionally. However, what we do goes so much more beyond that. So naturopathically, it starts with really how we see the world. Are we just machines, or are we intelligent systems, intelligent beings, and part of an intelligent universe? So when you start looking at a patient this way, you see that what the capacities they have for healing go way beyond simply a series of biochemical reactions we have to fix with a medicine because they're deficient in antibiotics, or, you know, really, I mean, having a deficiency of antibiotics perhaps, or do we use antibiotics wisely when it's indicated? So seeing it that way. Also, health is constant and natural state of being. So restoring us to our original state of health. Ill health is an adaptive response to disturbance in the organism. It does not necessarily mean something's wrong with you. It means your body's going through a healing process. And in our profession, we hear of events called healing crises. That's actually when your body's strong enough to mount an immune response instead of still staying at this fixed homeostatic state. So also, removing the disturbing factors resulting in potential return of normal health. So you find what's blocking the patient from being their best and removing that rather than just necessarily adding something on top and, oh, here, take this. Maybe remove this, remove a stressor, maybe you have a cell phone on all night at your ear and that's why you can't sleep. Sometimes it's very common sense, but common sense is not always so common. And using the least force necessary to stimulate self-healing. So that's also important. When all you have is a hammer, everything looks like a nail, right? But here we have so many tools in our toolbox. Some are incredibly gentle, but the gentle things are so incredibly powerful. So here is a very important, crucial concept in what makes naturopathy so unique, is that it's about vitalism. So life and consciousness is not solely by chemicals alone. We have chemistry. We draw blood and look at the blood chemistry analysis, and that's one of the basic tools that we use. However, we understand that there's something much greater that's breathing spirit into us. Spirit means, the root word means inspire, to breathe in. So that's that vital force. All living organisms sustained by that vital force. And that life force provides a catalyst for healing in life. In our society now, it's more and more common you hear of Reiki healers, energy workers. How does that work? Why does it work? I mean, certainly placebo effect is one of the best studied modalities, in the journals you'll see. However, and there's more. I mean, there have even been studies of prayer in cardiac patients. Patients that were prayed for did better. And how and why? I don't know. So, and there's new models trying to explain that through intentionality. So these are all mysteries that we're learning how to study with an open mind, but with the rigors of science behind us. So you have the best of both worlds that way. So healing power of nature, this is one of the bases of our philosophies, the vis medicatrix naturae. The healing power of nature, this is what restores health in our body. It's our body's natural biochemical, bioenergetic process to stay healthy. And it's our role not to fix the patient, but rather support and facilitate this process. We're the guides to get somebody up that pathway to the peak. And it's not simply, we've had patients come in who say, I'm good, but I want to be better. You know, I'm sick, but I want to be well, but I'm good and I want to get better. How can I get to the next level? So this is an ongoing journey of health that connects with everything and everything who you are. So we as naturopathic physicians, we support that. We remove obstacles to health and support the creation of a healthy internal, external environment. We've heard about the terrain, the gut-brain connection, how much of what we eat affects how we think. You know, serotonin is manufactured, synthesized from tryptophan in the gut. So people who have gut problems with what they eat, their stomach pain, they might come in with depression, and that's one of the connections. So necessarily, is the plan to give them an antidepressant, or is it to treat the root cause, which could be the dysbiosis? So we look at every case separately and uniquely. And we are a unique set of physicians who deal with, and primary care physicians. It's an art, it's a science, and philosophy. And diagnosis, treatment, and prevention of illness. And our goal, we are endeavoring to create optimal health. And also education and the rational use of natural therapeutics. So it's really about self-empowerment. We have a lot of handouts we work in the clinic to help each patient walk out with something they can take with and incorporate into their lives. Not simply a fix that gets rid of what's going on top, but really something, a deeper solution. Because we want our patients to get better, not just better. So naturopathy, it's the principles that make it unique. And we observe things objectively. And with that objectivity, meaning we'll see a patient, we take the vitals, we take the measurements, we look at the skin. The skin might, let's say if the skin is red somewhere, that might suggest inflammation or infection. And yet when the skin becomes cool and not so inflamed or red, we know the infection has been dealt with. So we use those objective measurements in addition with, sometimes we might get an impression, an intuition about, hey, let's try this. But then we'll research how and why this might work, and then make sure it's the right application, and then suggest it. So once again, left brain, right brain, intuition, rationality. It's the whole enchilada. And naturopathic physicians, I mentioned, we use modern and traditional scientific and empirical methods, which is what is so exciting to me. I'm working on a research project in collaboration with Duke University Medical Center, my alma mater, on the effects of sound and mood. And I go to Peru and work with a shaman indigenously. And naturopathy is broad enough to embrace that, and I could take the best of all that and offer it to the patients. So here is how we like to see, here's our model of how disease works. You have normal health, and there's a disturbing factor. Let's say, you know, you were traveling too much and the air got recirculated into a plane, you feel sick and run down. So your function's disturbed. So what do we have? We have fever, we have inflammation, and that's what we call the discharge process, where the body seeks to get rid of that infection. So one of our approaches, if the patient's willing to, is we will actually help the patient work through the fever. We see the fever as a sign that the patient is healing, as long as the fever is not too high or too long. So that's one approach. But we see it as happening that. There may be cases where we could give something to suppress the fever if it's necessary, but that's a case-by-case decision. And we want to make sure the patient does not go into a chronic reaction or degeneration if you don't have the strength of your body to go back into normal health, to shake that junk off. So what do we do as naturopaths? This is very core to how we practice. We look at acute and chronic concerns. We're very good at treating chronic, bless you. So somebody's had a stomach ache or bad digestion for months or years sometimes. We have patients who come who've been always fatigued, who've had hormonal issues. These are things that are chronic, and we can help with, as well as acute, a combination. So we establish the conditions for health. So basically, what is it that the body needs to feel healthy? Stimulate the vis, stimulate the vital force. What does that include? In some cases, we would suggest doing exercise. We do have hydrotherapy shifts where we stimulate vasodilation, vasoconstriction, hot and cold compresses to stimulate, kick that vitality into gear. Tonify the weakened systems. maybe you do need some botanicals. Correct the structural integrity. What in your body is keeping your tissues, your bones, from being at their best? Addressing the pathology. So using natural substances whenever we can. We have choices of homeopathy, we have botanicals. We have glandular supplements. And as well, we have pharmacologic substances. But you see, we have so many choices, and we go from the least invasive to the most as needed. Suppress or surgically remove pathology. That's down the line. We may refer if necessary. But again, we're trained to deal with the entire spectrum. And if you work correctly and astute enough, you prevent that last resort. So, our principles, the healing power of nature, identify and treat the cause. Why is this happening in the first place? And these are questions we ask anytime we have a patient coming in. We have it on our placards, we have it built into our computer screens, even on our note-taking when we do charting here at the clinic. First, do no harm. Doctor is teacher, and that's crucial to our profession. We're so passionate about helping you learn, helping patients learn. Treating the whole person. So it's been the saying, are we treating disease that has the person, or do we treat the person who happen to have the disease? And prevention. So don't get sick in the first place. So we do suppression if necessary, but we find that suppression interferes with healing. We also use substances that minimize risk and harm. And we respect the work of this healing power of nature. So what are some of the determinants of health that I mentioned earlier? Well, there's so many factors that we look at and that we can encourage you to do as a patient. And as a student, you'll learn all of this, and it's just in your blood. You get it from day one in your curriculum till the day you graduate. It just becomes a part of your life. How's your spiritual life? You get fresh air, nature, clean water, natural light, loving and being loved. We ask, how's your social support? Are you getting supported socially? Do you have friends or family, support groups? Diet, nutrition, rest, good food, unadulterated food. So non-GMO if possible, organic whenever possible. Can you grow it yourself? We also look at meaningful work. Do you have a good life-work balance? What do we do as clinicians? Well, we have a nutrition program because the emphasis on nutrition is so key. Let food be your medicine. Let medicine be your food. Lifestyle recommendations. Physical medicine. So we can look at structure, and depending on which state, we can do physical manipulation, but that's built into our training. Bioenergetic and mind-body medicine, a big passion of mine, in case you don't know already. And prescription medications, including hormones. And also we can collaborate with other physicians. IV injection therapy. When I'm really sick and I'm run down, I could go for an IV or injection therapies. We've done at SCNM as well, at the other clinic, where prolotherapy and help regenerate joints and inflammation, tendons, ligaments. Minor surgeries in our scope, botanical medicine, hydrotherapy I mentioned, also referral and collaboration with other providers. So I also want to mention traditional Chinese medicine and Ayurvedic philosophy. And that's built into who we are and what we do. And it's actually built into our curriculum. And Dr. Olhaus had mentioned how our scope of practice in California, we're making an effort to enhance it and to increase it. Right now, to my knowledge, acupuncture is not yet in our scope. In California, however, Arizona it is. And I saw how healthy and helpful it was to stimulate the vital force. However, we're also trained and encouraged to collaborate and refer and be a team player. And for example, more recently, I have begun having a conversation with an acupuncturist who actually happens to be here. Feel free to stand up, Ioana.
Hi, everybody. I'm Ioana.
So, Ioana has, she's trained at 2 years in PCOM, and she's licensed. She graduated from Baylor University as well, and works with East-West diagnosis. So this is where, as naturopaths, we get to, again, take the best of both worlds. And she's also pursuing a doctorate in endocrinology on that aspect, as it applies to traditional Chinese medicine. And she'll be speaking at Grand Rounds, so it's very exciting to collaborate and brainstorm. So she could do acupuncture, for example, for a patient that I may not be able to, and you get the collaboration effect, the team effect, that maybe one alone doesn't. That's called synergy. So our profession is open that way, that synergy that's possible when people collaborate. So I wanted to see if everyone had a chance to take a look at those books. Raise your hand if you haven't a chance to see the book on, all right. It's so juicy, people are hanging on to it. So there's one going on back there. Who has the other book? All right, we'll just keep passing it around. And we have a few more minutes for questions. So does anyone have any specific questions about my experience here at Bastyr as a resident, or what makes naturopathy tick? Good. That's my job then. Yes?
I didn't hear what you said.
Oh, anyone have any questions? Anyone has questions about what makes naturopathy tick or my experience at Bastyr?
Well, I'm kind of curious about the acupuncture. I believe it's not in this curriculum at Bastyr, but I know it was at SCNM for you. So do you feel like practicing over here, you don't, you physically licensed or wise can't do the acupuncture, but like you said, you can work with her. Do you feel that to be obviously a benefit, but in any way a detriment for you to not be able to utilize that skill?
I don't feel it's a detriment at all when you can collaborate. Because there's only so much one person can do, and you find what you're really good and passionate about, and then let other people work with you who are also equally passionate. So it's absolutely not a problem, no, not at all.
And I'll add in there that Arizona is the only state where naturopathic doctors can practice acupuncture under their ND license. In any other state, you actually have to have a license in acupuncture, which is why Bastyr does offer a dual degree, which is currently at our Seattle campus, maybe someday here in San Diego, but that is the only place where NDs can actually do acupuncture is in Arizona.
And do you know what, so I know that there are some good schools for that here too. What is the added, like, course amount or hour amount to do that?
There is a school here locally in San Diego, Pacific College of Oriental Medicine, and one of our students in his fourth year has decided to kind of create his own dual program. I don't know how much transfer credit they allowed, but we could always put you in touch with him if you might be interested in asking about that for sure. Yeah.
And the profession also is moving towards a doctorate versus a master's.
Right.
So that's one of the things we're looking at as a university too. Do we create, a program for a doctorate of Oriental medicine versus a master's? So the profession as a whole is going through a lot of changes with that.
And the sky's really the limit, as I've seen this profession, is just limited by your own imagination. Yeah. So thanks again, everyone. It was a real pleasure speaking with you.
And I did want to point out, everyone, that in the back